Well, thousands of registered nurses at several city hospitals are threatening to go on strike.
The New York State Nurses Association says inadequate staffing is keeping nurses from giving patients the care they need and deserve. Fox 5's Carrie Drew is live now in East Harlem with all the details. Good morning, Carrie.
Jen and Lori, good morning to both of you. Nurses here at Mount Sinai Hospital and at 2 other hospitals in New York City are threatening to walk off the job. They say staffing shortages are putting their patients at risk and their complaints are being ignored.
Safe staffing saves lives. Staffing ratios saves lives. I'm saying this because we have a staffing crisis. Emergency rooms are overcrowded. Every inch of space is being utilized.
Nurses at 3 city hospitals say they will strike within weeks if hospital management continues to ignore their demands. They say not only is there a shortage of nurses, but there are not enough rooms for the patients they care for.
The somber reality is we have patients in hallways beyond our bed capacity because of staffing.
Yesterday, nurses overwhelmingly voted to authorize a strike. It could affect more than 10,000 registered nurses at Mount Sinai, New York Presbyterian Hospitals, and Montefiore Medical Center. Reports say these nurses have worked without contracts since December.
Patients are in jeopardy. When I come into work, there are days that I am afraid I won't have the time to do what I need to do for my patients. It's not fair. It's not right. Hospitals need to respect nurses and respect patients.
According to the New York State Nurses Association, just last year, over 20,000 nurses filed nearly 4,000 complaints detailing the conditions inside the facilities.
Nurses are expected to take patients that we are not properly trained for because of staffing.
In response to the threat of a strike, a spokesperson for NYC Hospital Alliance says, quote, "It is simply not true that staffing levels are unsafe. The fact is that our hospitals are nationally recognized for providing the best patient care and excellence in healthcare outcomes. We have been clear with union leadership that if they call a strike, we will be required to move forward with our plans to bring in trained and qualified replacement nurses to help care for patients." So as of right now, there's no date yet for when a potential strike could happen. These nurses do say that they would give the hospitals a 10-day notice in order to prepare. We're live this morning here outside Mount Sinai Hospital in East Harlem. Lori and Jen, I'll send things back to you.
All right, Carrie, thank you.